Once again, we're breaking into programming to bring you this breaking news. Milwaukee County officials are joined by U.S. Senator Tammy Baldwin today to give an update on coronavirus. This is the overall coordinator for the county, and here is Chief Executive, or rather Milwaukee County Executive Chris Apley. Let's listen.
The numbers, we again increase in cases, increase in deaths, and as has been the case all the way through, the overwhelming majority of confirmed cases are African American. The overwhelming majority of deaths are African American, and that's in a county where African Americans represent just 26% of the population. Again, it is the disproportionate impact that we alluded to when a little over a year ago, the county declared racism a public health crisis. It is, and this is why there are a ton of underlying factors. But the good thing is, as a group, the collaboration has been great. As a group, we've discussed this issue specifically every day. And I want to thank everybody for their commitment to addressing this and further their commitment to making sure that as a community, we learn from this. It would be inexcusable for elected officials or public leaders of any type to see such stark and tragic illustration of the conditions that have existed for decades spelled out and not respond more aggressively than we have for any other cause. I'm delighted, as I said the other day, to know that my successor will be David Crowley. I'm delighted with the fact that he has reiterated his commitment to continuing this work, and we all know he will and already does. But finally, I want to thank everybody for their commitment to staying home, staying safe. I know it's tough. I know it's the weekend. It's sunny, but we bend that curve down when we stick with the plan and we isolate. So with that, I will turn it over to Dr. Weston.
Thank you. Good afternoon. As County Executive Apley outlined, we are at 2,507 confirmed cases of COVID-19 in Milwaukee County and 145 individuals who have died. These numbers that we read off each day come from our Milwaukee County COVID-19 dashboard. We've worked hard on this dashboard to ensure that we are being transparent with the public while providing essential information for stakeholders and decision makers. The easily digestible information is what you initially see, and then you can drill down into the tabs and layers to get more detailed insight into the effects of this pandemic on our community. We've ensured that race and ethnicity information is on the front page and bold, and one of the first elements that you see. We haven't done this because we're proud of the degree of disparities in our community, but instead because we want to highlight the disparities as we seek to understand and address them. COVID-19 was far from the first example of racial inequity in our community. Long before COVID and continuing to this day, we see African Americans dying 14 years earlier than whites in our county. We have a 3 times higher infant mortality in African Americans. We have higher rates of heart disease, strokes, cancer, diabetes, the list goes on. But now with COVID, we can see the rapid progression of disparities in our community. Rather than the prolonged morbidity and mortality that accompanies chronic disease, we can see the unequal distribution of COVID-19 spread in our community in near real time. We can see that an African American person is nearly 3 times more likely to die of COVID-19 in Milwaukee County than a white person. And they're a staggering 7 times more likely to die of COVID than a white person in the state of Wisconsin. And the reason for this is not due to individual choices, rather, it's due to the historical, institutional, and ongoing effects of disparities, of marginalization, and of racism in our community. Our county is not alone in these disparities. A critical step to addressing racial inequity, both within our county and beyond, is to recognize it, to collect the data on race and ethnicity and report these numbers, to better direct resources, to inform policy, and to work toward equity. Milwaukee County has been transparent with these numbers, and we hope that others can follow and do the same. Thank you and stay safe, and I will hand it off to Commissioner Kowalik.
Happy Friday, everyone. So as the county exec noted and Dr. Weston, we are at our 6-week mark since we detected our first case of COVID-19. Since that point in time, we've measured the impact of COVID-19 on race and ethnicity in our community, and we continue to see disparities. Because we were one of the first to have this level of information, and others in the community were paying attention to this as well, and not just within Milwaukee or in Wisconsin, but across the country and then internationally, how there was more attention and more sharing, and we started seeing very similar trends and distributions. So I saw a comment that we're not measuring race or ethnicity, that we are measuring racism. And I totally agree with that. We're seeing this play out time and time again. And, you know, it's exhausting to be able to even talk about this over the weeks. There's so much work that needs to be done as far as economics and ways to really help our communities thrive. So I know that, you know, we have a docket of speakers today that'll touch on some of the points of what can we do and what is being done moving forward. But the Milwaukee Health Department has played a role in our COVID-19 response, a very quiet role in some ways, helping to move resources and connect people to others that are doing the work. We have been listening to some of the comments about that, about where's the health department, we don't see you. So we do plan on being more proactive besides just doing things behind the scenes. So be prepared to see health department and our logo more broadly displayed as a part of this COVID-19 effort. And I believe that's important to just note too, that we are listening to the community. I know there was an article yesterday in the journal Sentinel about contact tracing and case investigations and families not hearing from their loved or hearing from the health department about their loved ones. And when we hear things like that, it definitely makes us pause because we're moving so quickly and we're doing our absolute best, but we definitely need to do better. So I just wanted to acknowledge that some of that information, again, I think was addressed yesterday, but just a general sense of our case investigations and contact tracing in general up until this point in time has been about 7 days from start to finish to complete, and that it's about a 92% completion. That 8% is some of what you're hearing about or seeing, and there have been some challenges connecting to certain people in our community. So we're learning more about some of the barriers that we have as a government entity. For instance, when the health department normally calls, it comes up private. So how often will you answer a call that comes up private? And I joke with the mayor and the police chief about this. If I get a call at like 8 in the morning on the weekend, I know it has to be one of them. But more often than not, if you get a private call, that can be a barrier to being connected. Also, we have a very transient community. So acknowledging that there's movement, numbers change, and how can we use technology, social media to connect people? Sometimes we've learned about people that have lost loved ones to COVID-19 through social media before we see it officially posted by the medical examiner. And that's normally when we respond, when we receive something from the medical examiner's office. But just the way that we can use different tools and ways of communicating to enhance the response. So I just want to acknowledge everyone that has played a significant part in this response. It is quite the lift. There's other health departments in the area that have been helping out. The state has provided additional support. And then we also have partners from outside of our region that have offered support, even if it's something that they use and they're like, hey, this is working for us, maybe you want to consider this. So just this like wealth of knowledge and information sharing that's going on, because everybody's learning as we're going along. This is a new virus for us. And even though we've had patterns and models for other outbreak responses like H1N1 or pandemic flu, this is nothing that we've experienced before. Again, there's no vaccine, there's no antiretroviral. So we're basically stuck with this social and physical distancing that we've been upholding. And I know it's been very hard, which is why we're seeing some backlash and questioning about it. But it's our best defense at this point in time. So just bear with us. I mean, I'm a social person. I want to be out and about just as much as anybody else. But I also wanted to just highlight a couple of other updates related to public health. So we went through the statistics of where we're at, pretty much the same week by week as far as distributions by age, gender, and race and ethnicity. I do want to talk about the election data, and I'm not going to go into detail because that data is still being finalized, but I know that our Lieutenant Governor, Mandela Barnes, went on CNN this morning. He talked a little bit about the data that they had at the state level, and that there were 23 people that they had identified had developed COVID-19 through election activities, whether you worked at a poll or you actually voted in person. So the data that we have now, last time I talked about this, I said that we had 7, but now there's 40 people that have showed up, and that we're analyzing more to show the connections between the people. So we hope to have that data ready by May 1st, which is next Friday. So stay tuned for that report. We've been receiving a number of inquiries, but as you can imagine, that's a lot of data to sift through. And as we're finalizing it, we want to make sure that it's very tight. And even though we can't, or we don't have the ability to run a full research study, I've seen that in some of the comments, we're practitioners. The academics and the researchers, that's what they're there for. They can do a more larger level analysis, which takes more time. But we're in the moment now, so we need to have some data now to help use this data to prevent the spread of COVID-19 in our communities. So the other thing I want to talk about is long-term care facilities. We've received a number of inquiries about this as well. But just to give you a sense of where we're at as a county, so there's 882 long-term care facilities, and right now there's 24 outbreaks, or 24 facilities that have an outbreak. The state updated this criteria to mean if there's an outbreak, that means that there's at least 1 case. So depending on how they're isolating or whatever. Out of that, the percentage is about 2.7. So you see it's a very small percentage of long-term care facilities that have an active COVID-19 outbreak. But that equates to 96 loved ones or people that are suffering and fighting COVID-19. So again, any inquiries that we receive about long-term care facilities, about communications, about any concerns family members may have, we are deferring those to the state since they oversee long-term care facilities. And they have been being very responsive and following up on those claims. We also have been encouraging long-term care facilities to be transparent and to share information about what's happening. There's some updated guidance, some federal guidance that's coming down the pike related to what that needs to entail. So there'll be more information about that. But just collectively as a county, I just wanted to provide that level of information because many of my peers, other health officers, have been getting the same inquiries. And then lastly, I just want to highlight this comment about using bleach and disinfectant, and that is very, very false. And please do not take medical information from someone that is not a clinician. So Dr. Weston, Dr. Izzard, myself, but president or someone else that's not a clinician, I don't think that's wise. So we are monitoring if we're going to see an uptick in poison control calls. We should have that data by next week because it always takes about a week to get updated information. So that's all I have for today. Thank you.
Thank you so much, Commissioner Kowalik. And next we'll hear from Senator Tammy Baldwin.
Thank you so much. I'm really glad to have an opportunity to join this call. And I want to thank County Executive Abley and Dr. Weston, Dr. Kowalik, and so many others for your leadership and steady hand in a time of unprecedented sets of problems. So obviously health disparities, and I would add economic disparities, are having an incredible impact on higher rates of coronavirus among Milwaukee's African-American community. And in particular, we're also hearing that the pandemic is disproportionately impacting the Latinx community as we start seeing a spike in cases in South Milwaukee. Serious health disparities among our most vulnerable Milwaukeeans existed a long time before this pandemic began. And we have to make use of the data in order to continue to be informed about a path ahead that closes those disparities. I want to commend Milwaukee County and in particular Dr. Kwolek for really shining a spotlight on these disparities that actually, I think, helped inform the whole nation. Last time I talked with Dr. Kwolek, she had just been quoted in a national publication about the fact that we're one of the few communities in the country, frankly, who track the data by race, ethnicity, and other factors that provided us with the knowledge. And I think because Milwaukee County was a leader in this, we have a lot more leverage now to see this data being collected statewide. And I am pushing fervently for it to be mandated to be collected at the national level. Started working with my colleagues, first just in letter form. Now we have introduced last week legislation to mandate that the CDC collect all sorts of granular demographic data. We, in our bill that was passed this week, require that for testing in the testing funding, but we need to see it across the spectrum. Positive tests, negative tests, we need to see access to testing by communities of color, but also how many result in hospitalization, how many of those result in ICU stays, how many of those result in ventilation care, and certainly we need to know specifically across this country about deaths due to the coronavirus. So we are working very hard to try to make sure that becomes law in the next legislative steps we take at the national level. And I know it's beyond the scope of this particular daily briefing, but I just want to make everyone remember that there's also economic disparities. And even as we put together these large programs to help, say, small businesses keep afloat during these times of struggle, even those programs are showing disparities in who can access them and who can't. We're trying to fix that as we move along, but it's a fight against all of these inequities and disparities that we undertake. And I just want to again thank Milwaukee County for your leadership in declaring racism a public health issue. It's shown a spotlight that is incredibly important to shine.
Thank you, Senator Baldwin. And next we'll hear from Wanda Montgomery, who's President, Village of Brown Deer.
Good afternoon, and thank you, Brian. And certainly, thank you, Senator Baldwin, for taking the lead on introducing this legislation that's going to be important for us moving forward. Today, I want to just come back and share with you some points that we really need to stress in our community, and not just the African-American community, but the entire community. In the last few weeks, we've talked about the importance of social distancing. And when you're out, you know you're going to be in the public in a situation for more than 10 minutes, that you should really exercise being 6 feet apart and wear face masks. Certainly constantly washing your hands. If you're out, keep hand sanitizer with you or some type of something that you can wipe your hands. Use the hand sanitizer. These are practices that we've seen working. The social distancing has been working. It's helping us to flatten the line. As we look at the stay-at-home was supposed to be lifted today. Many of us know that, but it's been extended, and it's been extended for a reason. It's been extended to keep us safe, keep us healthy, and keep us alive. And so I want to encourage you. I know that there were people probably planning. Today was the day that we were going to be able to get out and do whatever we wanted to do, with some restrictions. I want to just encourage you that let's stay in this for the long haul. You know, we need to stay in it for the long haul for all of us. So we want to remind you that when we say social distancing and not being in groups of more than 10, that means you can't necessarily host a party at your house, a baby shower, a bridal shower. A lot of those things right now need to be restructured. I got an invitation today for a Zoom baby shower. So I've already accepted the invitation. I'll go on and purchase my gift, and it'll be delivered to the home. My mother turns 86 on Sunday. Every year we celebrate her birthday. We come together. She has 9 children, 40, 50 something grandchildren, and I don't know how many great grandchildren, but we're going to be doing a Zoom birthday party. My mother doesn't know how to do Zoom, but I have a sister that lives with her. So we will be doing a Zoom birthday party, and we'll mail the cards to her or we'll drop them off. But we have to make adjustments. We don't want her to miss her 86th birthday because of the restrictions that we're going through right now. But because we want to see her on her 87th and her 88th birthday and her 89th birthday, and we want her to be healthy. So what I'm saying to our community, not just the African-American community, we all have skin in the game. We all need to share and participate in this so that we all come out healthy. And one of the things that I shared the last time I was on that I had taken to making face masks, I made my husband one. It was black. He told me I can't wear a black face mask out in public because they may think I'm trying to do something. So this isn't his, but it's mine. So I made myself a face mask. I've made several, and they work. I can talk, no problem. We need to do what we need to do so that we can be around after this. And when I think about the social distancing, this is near and dear to me in terms of the lives that have been lost. On last Friday or last Thursday, we heard about Eugene King, and I understand that his death was not necessarily related to COVID-19. But COVID-19 to me is just a word. There are names behind COVID-19. Some of the names that are near and dear to me in the last 7 days is Catherine Pfeiffer, who would have been 85 on her birthday. It's my sister's mother-in-law. She died related to COVID-19. George Matthews, a pillar in our community, died related to COVID-19. Gloria Robinson would have been 65 on her birthday, co-owner of Nino's Southern Sides, which is a restaurant that I frequented. But Gloria and her husband, Odell, and my husband, Floyd, and I celebrate the same anniversary. This year would have been 47 years. So this is not, COVID-19 is the title that's out there, but there are real names behind COVID-19. And there are names that are family and friends and colleagues that we need to think about when we say we want to lift the ban and go out and do what we want to do. Think about the person who's sitting now in the hospital that's on a ventilator or on oxygen that may not make it out. Think about those people. Think about the families that can't see their loved ones in nursing homes or long-term care. Or I can't even see my mother physically. She lives in an apartment, but we are honoring being safe at home. So think about those things when you think that it's okay for you to go and do something. Somebody else is suffering, and we need to all have skin in the game. Thank you.
Thank you very much, President Montgomery, for those very eloquent remarks. Next, we'll hear from Dr. Tito Izzard. Dr. Izzard, you're muted.
Yeah, thank you for having me join this session. And thanks to Senator Baldwin for being here and introducing this legislation. I think more importantly, bringing an awareness to this issue, and she mentioned it several times, the issue of economics and the impact that it has on African-American communities. Most of you that have heard me speak before notice that I really try to drill in to this concept or this issue of not just the social determinants, but the actual economic determinants that are impacting the African-American community. It is the lack of economic inclusion in this country that has resulted in the consequence of the lack of health parity, meaning the unequal outcomes relates to all these health conditions. So we know that the COVID-19 virus tends to have a more serious impact or effect on those that have conditions of cardiovascular disease, such as hypertension or previous heart attacks, those that have respiratory illnesses, such as asthma or COPD or emphysema, respiratory conditions, or people who have diabetes, or people who may have cancer. And so all of these things, we know that the African-American community, particularly those African-Americans who have historical lineage to slavery in this country, have since the beginning have always failed to have health parity, meaning even before the foundation of the United States, we lacked the parity in health outcomes. So what we're experiencing now is not a new phenomenon. Okay, this is something the COVID-19 virus has just exposed. It only exposed the fact that in this country, American descendants of slavery in this country, the health disparities is a direct consequence of being an American descendant of slavery. And what Senator Baldwin was talking to regarding the economic impact, that without truly beginning to address this issue, we're only putting a Band-Aid on it. So African Americans in this country, in many different scenarios and situations, has been the canary in the coal mine. And when we look at the impact of COVID-19, as it began to spread across the United States beyond just those who were travelers and had the luxury of doing so, when it really hit communities, African Americans became the canary. So when the canary starts to die, everybody runs to safety. But the question is, have we ever thought about what happens to the canary? And that's what's happening in this country, is that African Americans are sending a warning once again to this country of our need to truly have a holistic approach to how we're going to look at health, right? The only way to truly address this issue is to create restorative health equity for vulnerable populations, to be able to bring people back to a state of wholeness where they were prior to the historical insult. Anything less is just purchasing another canary for the next crisis.